The U.S. healthcare system facing demanding conditions in the year of 2023, where hospitals continue to operate in the red, dealing with physician and overall staff shortages on top of inflation, and contending with the triple respiratory threats. The positive note, however, drums on the adaptation of digital health solutions to improve patient access and hoping to reduce physician burnout. In this episode of Provider's Edge, we combine this year's most resonated episodes that demanded by our listeners like you. Combined expertise from our leaders, individual private practice to hospital executives and to innovators. Bring you together one powerful session that you won't want to miss. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. First up, let's revisit our episode with Fabio Pereira, who owns a urgent care practice in Florida, where he shared the practical solution of operational efficiency, a true hit among business owners looking for the best solution to continue push forward. Have you been doing that you find helpful?
I think the most helpful part is managing my time a little bit better. And you start noticing that as you go. In the beginning, I'll be completely honest. I still worked my job at another urgent care in another county, so it wouldn't compete with the urgent care that I had started. And I would do 12-hour shifts there. And I would take my bags with me. I had 4 different bags at the time. One is like oxygen, the other one's medical, the other one's IV therapy, and the other one's like procedures. So like oxygen tanks, everything. So after finishing a 12-hour shift, my wife would actually be picking up the phones at that time, and I would go see patients that for my business after finishing the 12-hour shift. So then it slowly became, I was doing about 84 hours a week or averaging. And it was just the beginning because I still had my other job. I was trying to get the company, going with market traction. And then you slowly start coming off of that because you need time for yourself and your family and things like that. So there's three things that I got from Patrick B. David, which totally makes sense, is outwork, outperform, and out-strategize. That's when we're talking about the. And I think in the beginning you do more of the outworking and performing because you're not there yet to be out strategizing, right? So when you get more into that level, then you start realizing, okay, well, I need to manage my time a little bit better. I need time just to think and just like run numbers on Excel sheets and just like for fun, just trying to figure things out. Try to strategize marketing campaigns and services you want to tackle. So I think that's the biggest thing that I've learned that I'm going through right now at this point is like you mentioned before, what can I do? What do I not need to do so then I can see more patients? Because that's what's going to generate the revenue. So that's where I'm using my time a little bit better these days.
Perfect. And then now you're at a stage of really growing and potentially scaling, right? And then I know you have a small team of 3. Is that it?
Yeah. So I have it's a team of 3. We have my wife, which is our CFO, myself, and then the medical director. Those are our main people that are within the company. Now, we do have third parties like other people that do our Google ads, or someone else that does our SEO and website maintenance, and so there's different things that we use outside of. But that's the 3 of us.
Right. Yeah, your core foundational people are the practitioners and the CFO who runs the practice versus other you contract out, right? The marketing side, so you don't have to be worried about what to say, how to say, the daily posts, keep up a consistency, and then have the right searchability, especially for a practice like yours is very location-based. Instead of some other people who has telemedicine, maybe they can spread it out a little bit more. I know in Florida, people are willing to go around a little bit. I know people like willing to drive a bit, but instance of your practice specifically, do you have set locations?
So we have one location, and but we're primarily a mobile urgent care. So we actually go to patients' homes. That's how we started off, and we do a lot of that still. And then we have one location. Now, the main things that we do is urgent care, IV therapy, which is like vitamins, minerals, and we started that really because of COVID, before we had monoclonals, because we wanted to support the immune system. So we said, okay, well, we already do IVs for dehydration, right? For nausea, vomiting, diarrhea. So why don't we just put vitamins in it? Okay, so we started doing that. And then monoclonals came into play. So then, so those are the main things we do: urgent care, IV therapy, monoclonals. And recently I started really targeting, in terms of marketing, targeting telemedicine. I think it's a big market where it hasn't really fully been tapped. I feel that it more usable, or people started using it more, feeling more comfortable with it. But I think that we're just at the beginning of that, because we're growing as a society. Millennials, we can use technology a little bit easier, things like that. People are busy, they're on the go. They just need, to speak to someone and have their condition taken care of as soon as possible, and so they can keep going. And that brings up a point where you always have to not just be in touch with the medicine side, but also keep a pulse on the market. And unfortunately, it's gotten so political with COVID that you have to be on top of politics. You need to be on top of economics, or the markets, not just how many cases of flu or COVID or monkeypox or any of those things.
Next up, let's dive into healthcare IT with Paul Vieira, where he shared insightful notes on how all the savvy entrepreneurs truly can leverage technology to better improve your practice and engaging with your patients.
So I went on to explore the idea further, and I was actually late with my paper. The professor wasn't terribly thrilled about my delays, but I said, I'm going to come at this from a completely different angle. And I worked at the local hospital and kind of saw how they did things. And they would set up the surgical room specific for that surgery. So if it was cataract surgery or heart surgery or neurosurgery, the technology that was going into that room was a very specific setup, and there would be a minimal technology fee for the doctor doing the surgery. So ultimately creating a win-win. The patient got the best possible outcome, the doctor had the best technology, and you had this full-fledged hospital-grade IT department within hospitals for doctors. So I came back and took that information and said, hey, we can provide a hospital-grade IT department that really helps doctors at the private practice entrepreneurial level. And that was my paper back in 2003. And that turned into To Serve CT, because the idea had a lot of merit. It was really good for everybody. It was good for the patient. It was good for the doctors. The university loved it. They got behind it. And that's how the company started, was in 2003 at the University of Connecticut. And today we worked with over 12,000 practices, 12,000 entrepreneurial doctors, and we help them achieve their vision and their dream. So often, people talk about how Surf got started, but with that type of experience, building 12,000 private practices and helping build these specific systems for the way that these doctors practice, not generically, but specifically for how you practice, we're able to empower doctors to realize their dreams. So it's been an exciting journey.
Yeah, I'm sure it can be, and especially from an early stage when people might not have thought about the importance of IT infrastructure, or they thought about it, they need it, but they don't quite get it. So it's great to have someone who has the vision and could create that strategy for the end users. So bring us back to, if you think about it, a lot of us who are clinicians gone through years and years of training, but on the practice side of medicine, dental, wellness. But it's not so much on business thinking, right? When they have to put on these different hats, they don't even know what they don't know. So when you approach someone, let's say, who has a new established practice, or even have been in there for a few years, but really don't have that foundation of IT infrastructure, how do you approach it? How do you make people aware, help them see what they're missing?
Sure. So we start by asking questions, and we start by first asking, if you could have anything at all, if you could have anything as a doctor, forget what you've been told in the past, what would that be? What is your ultimate vision? And, so often doctors will share, well, I went through dental school, or I went through medical school, and, I ended up here. And so it's like, like life kind of forces you into a certain situation, or you're reporting to a practice. You have this like cocoon-like effect where you're going to the same practice day in and day out, almost like reporting to a box, and you don't see everything that's possible. You don't have that global view of what's possible. So we always start with like, forget what you've been told. Like, if you could have anything at all, what is your vision? And the answers that we get are so unique. And so many doctors feel like they have to work within their practice, and that they go to work at their practice, and this is kind of how the place stays afloat. And we start to expand on that. And based on what their vision is, we're able then, with our experience, 20 years, 2 decades, 12,000 practices, and not selling one piece of technology, but helping them implement the technology properly, we're able to put a system in place that will create automation that will help them achieve their vision and creates alignment in practice, real automation. So often when I speak with doctors, if they're not really understanding, I'll give them a little analogy, and I'll say, your practice is running like a local coffee shop. You show up every day, you grind the beans, you put the beans in the machine, and you work really hard to sell coffee for 99 cents or $1.99, and you tell people to come in, and when you're here, people come in because they know you. But we're able to put these systems in to your practice that will help you achieve your vision and your dreams, and really make your practice run without you, which, sometimes is alarming to them. But, if you had more time, what would you do with it? And they don't understand it. And I say, look, if you're running a local coffee shop, we can help build you a Starbucks. And then suddenly, like, that trigger goes off, right? And it's really, really exciting when we start this journey with doctors, whether they're established and they've been practicing for 20, 30, 40 years, or we meet them in a university setting because the university invited us in to speak, and they have these big dreams. It's exciting when we start this journey and we hit these goals, because when you hit these life goals of more time with your family, or more freedom, or a business that runs itself, and really, really happy patients, because the experience is, designed at another level. It's exciting because the clients get really happy, the doctors are happy, the team is happy, the patients are happy. And sometimes, we get a call and the doctor says, hey, what's next? What can we do next? So when you have automation and you can take yourself out of that daily grind, that daily survival mode, and you can build a practice that starts to work for you, the possibilities are limitless. It's super exciting.
Then we dive into the topic is most listened, a special topic on the new focus of mental health within the healthcare system with J.C. Somers. As a physician associate and practice owner himself in psychiatry, we truly explore the strategies that you can use in your everyday life. Stay tuned. So there are multiple different components on our gut health that has, we know serotonin in there has a lot more, right, in our brain. So for back in school days, right, or any stressful moment, I know all of us have that gut feeling, the crunch. Well, like that's same thing as how our patients, especially when they are having more of a mental fitness concern, to be able to address how we eat really affecting everything in our life, not just the obesity pandemic that we're facing or the coronary artery disease that they really should be addressing, but so many more things. And I love that you're adding different component of wellness and holistic care into mental health as well. So just wondering, how many patients are you seeing on a daily basis now?
I would say I typically see about 15, maybe something like that. It depends, depending on how much I'm working that day. But I would say somewhere between 12 and 15 is about average. So yeah, and it's kind of a combination. Obviously, all my patients are mental health focused, but a lot of times we'll focus, more on diet and other things like that. I mean, I don't think those things are independent. I mean, the thing about a healthier diet is, we don't just live longer, but we die less painfully too. Right? I mean, the point is we're not trying to live forever. What we're trying to do is to address issues of quality of life. Everybody wants those things, right? I mean, a long time ago, we recognized the impact that tobacco had on our health, right? But 50, 60 years ago, that wasn't the case, right? I mean, that tobacco was outed as the killer that it was, a long time ago. But somehow we're still serving bacon at medical conferences, right? Because nobody thinks that that's healthy for us, right? And yet we're still kind of saying, oh, well, yeah, but every once in a while, right? But we don't think that about cigarettes anymore. We don't think like 1 or 2 cigarettes a day is okay, right? So, we constantly have to be addressing these things and realizing that there's a real biological drive for these things, right? There's a real, component of that our body has been working on for tens of thousands of years, hundreds of thousands of years. If you came across a donut 10,000 years ago, you better eat it, right? I mean, because you weren't going to come across that again. And you were walking 20 or 30 miles a day, right? So trying to understand how our bodies and our lives and the demands on us have changed, really, especially over the past 100 years, but especially over the past couple thousand years, right? And yet our brain hasn't changed very much at all, right? As far as how it works, how it's wired, how we respond to stress and danger and anxiety, all those things are wired in there. And unlike cigarettes, which we can completely stop and never need again, everybody has to eat, right? We all have to have that drive. And so then the question is, what do we eat, right? I mean, the CDC says that 1/3 of all deaths in the United States are due to diet-related conditions. 1/3. Right? I mean, those are hundreds of millions of people, certainly worldwide, that are dying every day from heart disease and diabetes and, obesity related things, right? All these things, not to mention all the cancers that are diet related. So if we can talk to people about these things, a lot of times I'll talk to people and they say, well, I thought you were in psychiatry, but to me, thinking that psychiatry is just about people who are depressed or anxious or schizophrenia or having bipolar disorder is missing the point. Right? Psychiatry, just like family practice, just like every other field of medicine, is about addressing our patients' needs, right? It's about quality of life. What do people care about, right? Identifying that, addressing that, moving those people forward on their journey, that is the point, right? And it's great to be, less anxious or less depressed, but if we end up dying at 65 of a heart attack or stroke, I don't know that I've done anybody any favors. Right? Not to mention that you suffer before that. So, really addressing that. And we're starting to understand so much about that now. You mentioned gut bacteria, but that's just part of it, right? I mean, inflammatory cytokines, how we're metabolizing certain medicines, right? The genetics and the epigenetics associated with, our environment and our food and stress level and sleep level, right? All these things play a huge, huge impact. So I talk to people a lot about that. And I think it's really, really important. I mean, I think we're missing part of that in medicine. We're kind of staying in our own little lane, but I don't know what our lane is, right? I mean, we're in healthcare. Right. And that's what we're supposed to be addressing.
Right. It's about integration. At the end of the day, we can even apply those to our own life. Are we living for what purpose and what's that big mission that we're going after. And yes, nowadays we talk about biohacking even. Now, some of those activities, treatments, whatnot are for people cash paid. So that means people can actually need to be able to afford that. So are we doing that as providers for ourselves, recommending for our patient? But what about all the underserved, underinsured, then they can't even get basic care because they keep running to the ER just for that one thing. And perhaps they did see you in a clinic, but they can be lost in follow-up for the past 3 years. You have no idea what's happening with them, or you have no staff to be able to reach out to them to close that loop. So I know thinking about quality of life for us is very important to be able to sustain the practice so we can provide the care and serve our community. Lastly, we explored the innovative financial structure with Dr. Karamanchi. His perspective on bringing cash model into businesses within healthcare has been groundbreaking, making it a top choice for the forward-thinking professionals. When was the moment that you feel like, hey, business side of building your own practice was something that you had a deep passion in?
So I got into the venture because there are a very limited number of clinics that offer this, even in Florida. So I wanted to create my own model, and I felt that this was the best model of care that can be delivered to the patients, especially with what I offer, like the energy healing, the yoga, meditation, and all of that. So that's the reason why I ventured into the business aspect. And it's much harder than being in corporate. In being in corporate, you go to your shift, you check in, do your stuff, you go home. You do have some leadership stuff to do, but the finance side of it, you don't deal with it. You don't deal with marketing. But there's still some sales. Even though you're in corporate, we still sell the surgery to the patient. That's the sale. Although it doesn't look like a sale, we just tell them to do it. So I think it's a different world. The business world at times I feel it's much harder than being in corporate.
Right. And that's true. Also, we're never really taught in grad school about business side of medicine. It's always research-based decision-making, finding out what's wrong, and then what's the best next step, and rule out the zebras and all the other things that we're really worried about for our patient. Yeah. But not so much when we're leading a team, it's beyond just the clinical side of the leading the team. Now it's become what are the other intricate of things that we really have to consider so patient can continue to come back to the office. And if we wanted to be able to see more patient, create more impact, what is that next step? Whether it is taking care of your existing patients better, engage with them more, versus doing the marketing strategies for connecting with the newer patient. So how do you find the balance in that?
Yeah, it's very hard. Like for example, like all of our patients in the integrative practice, we reach out to them via text, via phone, via email. It's much different than, my patients in traditional medicine. You never talk to them after they're gone from the clinic or the hospital setting. But here we communicate with them all the time. And if you don't hear from them, we go ahead and reach out to them. Because sometimes the patients forget that, if they have to do stuff or they have to come back and, see the doctor and sometimes they forget about like what we discussed 6 months ago. So it's about constantly reaching out, constantly communicating. I think the biggest thing I learned in business is all about communication. It's and every day I continue to improve on that. And it's communicating with the staff, communicating with the patients, and how better to do that. Patients love text message for some reason,
Yeah, and especially, I'm not sure what's the population you're dealing with. Is that seems to be elderly or like middle-aged?
Mostly middle-aged. We have few elderly patients, but mostly middle-aged. Anywhere from 35 to the 50s and 60s.
Exactly. And I think that's why the middle-age group, right, the 30s to 50s, and they're still pretty active. And we grew up with the technology part, and we just got so much usually emails in the inbox, it gets overwhelmed, or the business emails usually go to the spam. So people tend to actually see then text messages and, oh, there's an alert. I actually need to do something for my care. And so definitely one of the directions, even from the Medicare and Medicaid side, right, value-based medicine practices, I think our healthcare system start to shift in that direction. How do we take care of people as a whole? And the incentive, especially people with chronic diseases, I'm sure you deal with a lot of those, people bouncing around, trying to find different solutions. How do you really get to the care? And then with the new incentive, those messaging, these care coordination used to not able to be built. And then people don't really know how to take care of the patient and bring them back. Huge thing on communication. What do you say? It's not as even important on how you say it, how you engage with them in the right moment of their lifespan, or even just a week, right? Like sometimes people just get caught up with stuff.
Yeah.
So
I think it has to do with instant gratification, because they don't want to send an email or a message and wait for the doctor to respond for 1 to 2 days or 1 week. They want the response within like minutes to hours. I think that's where we're all going, and they want a constant conversation even after they're done with the visit. And that's where you probably had speakers about concierge medicine. We're going into concierge medicine as well. There are some clients, they really are so busy, they don't want to come to the office, but they want their medications to be refilled. They want the stuff done on a regular basis without being seen, and they're willing to pay for their service.
2023 was a landmark year for healthcare entrepreneur, marked by innovation, challenges, and growth. We reflect on the wisdom embarked by industry leaders, shared lights on how their strategies can revolutionize your healthcare venture. Fabio enlightened us on operational efficiency in healthcare professional businesses. Paul highlight the revolutionary role of IT. J.C. Sommer shared vital self-care practices for healthcare entrepreneurs, and Dr. Karamanchi explore the benefit of cash pay model for practice owners. Each episode offers unique insight, empowering healthcare entrepreneurs to thrive in this challenging era. Stay tuned next week as we feature the most listened episode on growing your business through marketing strategies, culture building, and optimizing leadership. As we wrap up in this reflection on 2023's most enlightened moments, please share your expertise on LinkedIn and tag me, Sabrina Runbeck, to join the conversation. We would love to hear what are your insights and takeaway from these episodes and how they can shape your approach in the coming year of 2024. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.